magazines, and online platforms. At Baljodkor has contributed a chapter, Ethnobotany of Plant Contraceptives, in the book Ethnobotany of India, Volume 5. The chapter is about different plants used as contraceptives in various forms. I would like to invite ma'am to this platform with great pleasure. Before starting session, I would like to go through few of the basic instructions to be followed throughout the session. First one, for uninterrupted class session, use laptop with high-speed internet connection. Then please make sure your microphone is on mute to have a disturbances-free session. In case of any disruption, please check out your internet connection firstly. And if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be raised, posted in the chat box. Questions raised will be cleared at the end of the session. Over to you, ma'am.
Namaskar, everyone. I thank DIKSHA Academy and KLE Shri BMK Ayurveda Mahavidyalaya Belagavi for inviting me for this webinar. And I wish everybody happy Women's Day and happy Holi. And may this Holi bring lots of colors and happiness in everyone's life. Thank you so much. And I pray to Lord Dhanvantri to bless everyone with good health and happiness. And I thank Dr. Tanuja Netri ma'am, Dr. Ahalya madam, Dr. Nisha Kumari ma'am, Dr. Usha Rani, and Dr. Tulya Mohandas for this wonderful webinar. So I'll start my presentation. The topic is breast cancer awareness and screening, which is very much required in the present time. So breast cancer is the commonest malignancy among women globally. From being fourth in the list of most common cancers in India during the 1990s, it has now become the first. It has surpassed the cervical cancer. It has now surpassed lung cancer as the leading cause of global cancer incidence in 2020, with an estimated 2.3 million new cases, representing 11.7% of all cancer cases. Over the last 26 years, the age standardized incidence rate of breast cancer in females increased by 39.1% from 1990 to 2016, with the increase observed in every state of the country. As per the Globocan data 2020, in India, breast cancer accounted for 13.5% of all cancer cases and 10.6% of all deaths, with a cumulative risk of 2.81. The incidence of breast cancer is typically higher in high-income countries. However, in the past decade, it has increased in previous low-incidence countries also. The Globocon database is one of the most important databases for understanding the global burden of disease, and it provides the most comprehensive coverage of the health burden of disease, risk, death, and disease-related disability. So before knowing about the breast cancer, we should understand the anatomy of female breast. So to better understand breast changes, it helps to know about the breasts and the lymphatic system. So the anatomy of female breast. So this is the female breast. The nipple and areola are on the outside of the breast. The lobes, lobules, and ducts are inside the breast. The breast also has a lymph nodes that go from breast to the armpit. So this go from the breast to the armpit. These are the lymph nodes and are part of the lymphatic system. The chest wall has skin, fat, muscles, bones, and other tissues that form a protective structure around vital organs. So the female breast has different types of breast tissue. mainly glandular tissue. It includes breast lobes, lobules that make milk, and ducts that carry milk to the nipple. Most breast cancers form in the ducts. Then fibrous connective tissue supports, protects, and holds bones, muscles, and other tissues and organs in place. Fatty breast tissue is found around the glandular and fibrous connective tissue. Then dense breasts have more glandular tissue and fibrous connective tissue and less fatty breast tissue. About the lymphatic system is a part of the body's defense system. It has lymph vessels and lymph nodes. The lymph vessels are thin tubes that carry a fluid called lymph and white blood cells. Lymph vessels lead to small bean-shaped organs called lymph nodes. Lymph nodes are found near your breast, under your arm, above your collarbone, in your chest, and other parts of your body. Lymph nodes filter substances in lymph to help fight infection and disease. They also store disease-fighting white blood cells called lymphocytes. So breast changes during your lifetime. So we should know what are the normal changes that occur during a female's life. So they occur before or during menstruation, during pregnancy, as you approach menopause, if you are taking hormones, and after menopause. So we'll discuss about this. So before or during menstruation, breasts may feel painful, swollen, or tender. You may feel one or more lumps during this time because of extra fluid in your breasts, and this is more common in premenstrual syndrome. Then during pregnancy, breasts may feel lumpy. This is usually because the glands that produce milk are increasing in number and getting larger. As you approach menopause, hormonal levels changes. This can make your breasts feel tender even when you are not having your period. Your breasts may also feel lumpier during menopause than they did before. So if you are taking hormones such as hormone replacement therapy, birth control pills, or injections, your breasts may become more dense. This can make a mammogram more difficult to interpret. So be sure to mention that you are taking hormones when scheduling your mammogram appointment. And after menopause, hormonal levels drop. You may stop having lumps, pain, or nipple discharge. So now coming to abnormal breast changes, and check with your doctor if you notice unusual changes in your breast. So here I will like to emphasize everybody that around your circle, in your circle, and all the females, your co-workers, your helpers, just educate them to take care of their breasts and notice any changes if present. So there is lump or firm feeling. It is called a mass. Nipple changes or discharge, and skin changes. So a lump or firm feeling, also called a mass, including a lump in or near your breast, a lump under your arm, thick or firm tissue in or near your breast or under your arm, or a change in the size or shape of your breast. Breast lumps come in different shapes and sizes, and most lumps are not breast cancer. So in a way, overdiagnosis is better to avoid the breast cancers. Then breast mass or the fibroadenoma. Now this photo shows a small lump above the nipple, this one. And these are usually common and they are benign. This lump was later diagnosed as the fibroadenoma. Then how to check breasts for a lump? So the self breast checkup is a must. It should be done once a month. So how to do it? Relax, know what's normal and what's not. Check your breasts once a month. Touch breast with in the shower with soapy hands. Take a good look in the mirror beforehand. Look for any obvious lumps, skin changes, nipple changes, or discharge. Check your armpits and know your family history. This is very important. Now, nipple changes or discharge, including fluid from the nipple that is not breast milk. Because nipple changes or discharge can sometimes be signs of breast cancer, they should be checked. However, nipple discharge can be caused by birth control pills, medicine, and infections. Now, these are the different types of nipple discharges. This is the milky discharge. This is yellowish and green, greenish multiple pore discharge. Then this is straw colored single pore discharge, and this is bloody single pore discharge. Blood is oozing out. Now, skin changes, including itching, redness or darkening, scaling, swelling, dimples, or puckers on your breast or nipple that don't go away. This is a warning sign. And as whenever you feel that these changes are there on the breast, consult a doctor. So these are the various skin changes. This is the tethering of the breast. This is purity orange, and this is retraction of the nipple. So various breast conditions. It is benign breast conditions, precancerous breast conditions, ductal carcinoma in situ, and breast cancer. So you should look for lump, pulled in nipple, dimpling, dripping, redness or rash, skin changes. So coming to benign breast conditions. So first is breast duct ectasia, also called mammary duct ectasia, a breast condition in which one or more breast ducts widens and thickens. This can cause the duct to become blocked with fluid. It may sometimes cause whitish, greenish, or blackish nipple discharge, tender or darker nipples, or inverted nipples. Breast duct ectasia is a benign breast condition that is most common in women who are approaching or have gone through menopause, and it does not increase your risk of breast cancer. Then cysts in the breast, closed sac-like pockets of tissue that can form in the breast. Most breast cysts are filled with fluid and are called simple cysts. They may be painful just before menstrual period begins. You may be able to feel a cyst, although some are too small to be felt. Most cysts are benign and do not increase your risk of breast cancer. Cysts are most common in premenopausal women and women taking menopausal hormone therapy. Then fibroadenoma, benign breast tumors that often feel like hard, round lumps in the breast and move easily. Fibroadenomas don't usually hurt and may sometimes be too small to be felt. Fibroadenomas are the most common benign breast tumors in women under 30 years of age. Although they can be found at any age, these tumors may get larger when estrogen levels increase during pregnancy or with hormone replacement therapy, and smaller during menopause. Most fibroadenomas are simple fibroadenomas and don't increase your risk of breast cancer. However, complex fibroadenomas are larger and may slightly increase your risk of breast cancer. Then fibrocystic breast changes. So these two breast conditions are quite common. So, and both of them are benign. A common breast condition in which you may have breast swelling or discomfort, sensitive nipples, nipple discharge, and itching. May also have a mass, also called lumps or cysts. Symptoms often start before or during your menstrual period. As many as half of all women notice fibrocystic breast changes. It's common among women under age of 45 and among women taking hormone replacement therapy. Fibrocystic breast changes do not increase the risk of breast cancer. Then mastitis, a painful breast condition that is most common in women who are breastfeeding. It's caused when a breast duct, also called a milk duct, becomes blocked or infected. Breast may look red or darker and feel lumpy, warm, and tender. You may also have nipple discharge or a fever or flu-like symptoms. Mastitis is usually diagnosed by a doctor based on your signs and symptoms. Then precancerous breast conditions. This is atypical ductal hyperplasia or the ADH, a breast condition in which there are more cells than usual in the breast duct, and the cells look atypical under microscope. ADH may increase your risk of breast cancer. Then atypical lobular hyperplasia or ALH, a breast condition in which there are more cells than usual in the breast lobules, and these cells look atypical under a microscope, and ALH may increase your risk of breast cancer. Then lobular carcinoma in situ, a breast condition in which abnormal cells are found in the breast lobules. There are more abnormal cells in the breast lobules with LCIS than with ALH. So lobular carcinoma in situ increases your risk of developing cancer in either breast. Then pleomorphic lobular carcinoma in situ is a breast condition in which abnormal cells are found in the breast lobules. These cells are often larger and more abnormal than in lobular carcinoma in situ. So, pleomorphic lobular carcinoma in situ is more likely to become invasive breast cancer than LCIS. In pleomorphic LCIS occurs most often in postmenopausal women. Then ductal carcinoma in situ. So ductal carcinoma in situ is a non-invasive breast condition in which abnormal cells are found inside the breast duct but have not spread outside it. So DCIS is also called intraductal breast carcinoma or stage 0 breast carcinoma in situ. Although the cells are abnormal, they are not considered cancer because they do not have the ability to break through the duct wall or spread in the body, which is the definition of cancer. So DCIS may sometimes become invasive breast cancer and spread to other tissues. So doctors diagnose some cases of DCIS as being at lower risk of becoming invasive than others. However, since doctors don't currently know for sure which cases of DCIS will become invasive cancer and which ones won't, so it is always treated. So these are the abnormal cells, and they have not spread. Then coming to breast cancer. Breast cancer, also called invasive breast cancer, is a disease in which cancer cells form in the tissues of the breast. Breast cancer is not just one disease. There are different breast cancer subtypes. In breast cancer, cells grow and divide without control and invade nearby breast tissue. Cancer cells may also form a mass called tumor and metastasize or spread to the lymph nodes or other parts of the body. So invasive ductal carcinoma is the most common type of breast cancer. So these are the cancer cells which have started spreading. So most common sites of origin. So this is the upper outer quadrant has chances of 39%. Then lower outer quadrant 9%, lower inner quadrant 8%, upper inner quadrant 15%, and then this is areola and the central part is 29%. Risk factors causing breast cancer. So factors that cannot be prevented are the gender, family history, aging, genetic risk factors, personal history, menstrual cycle, and mainly early menarche and estrogen levels. Then lifestyle risks mainly include physical inactivity, OCP use, not having children, late pregnancy, hormone replacement therapy, not breastfeeding, alcohol use, smoking, obesity, and high fat diets. And this is from the CDC. So now coming to breast cancer screening. So screening means checking for a disease such as breast cancer or for changes that may develop into disease before there are signs or symptoms. So importance of screening and early detection. It reduces mortality from cancer, reduces morbidity associated with advanced stages of the disease through early detection in asymptomatic women, reduces the effective cost of treatment and management of cancer. Now, this is the triple assessment for the diagnosis of breast cancer. So first of all is the history and clinical examination, then investigations, mainly imaging and tissue diagnosis. In imaging is mammography, ultrasound, MRI, and then in tissue diagnosis is fine needle aspiration biopsy or FNAC, core biopsy, and an excision biopsy. So rapid access to assessment and diagnosis of triple assessment. These are the main surgeon, pathologists, and radiologists. They are the important consultants. So screening mammogram. A screening mammogram is an X-ray of the breast that is used to find breast cancer. So this is how mammography is done. During the procedure, breast is pressed between two plastic plates. You will stand still for a few seconds when the X-ray is being taken. Some discomfort is normal, but if this is painful, tell the mammography technician. The X-rays are sent to a radiologist who studies them and sends a radiology report to your doctor. So two types of mammogram mainly is 2D mammography, takes pictures from two different angles, the side and above, and 3D mammography takes pictures from many different angles. 3D mammography is also called digital breast tomosynthesis, but 3D mammography here, exposure to radiation is more. So usually 2D mammography is done. So what can a mammogram show? So mammograms can show a mass or lump, calcifications, dense breast tissue, and other changes in breast tissue. So this is a normal mammogram. This is a benign cyst, which is not cancer. These are the breast calcifications. These are the small dots. And this is the breast cancer. So understanding a mammogram report, the breast imaging reporting and data system, that is BIRADS. So when the report is category is 0, it means that need additional imaging evaluation. So, and recommended next steps will be additional imaging needed before a category can be assigned. When 1 is given, it is negative. So continue regular screening mammograms. 2 is benign, not cancer. Continue regular screening mammograms. 3 is probably benign. Receive a 6-month follow-up mammogram. 4 is suspicious abnormality, may require biopsy. 5 is highly suggestive of malignancy, that is cancer, requires biopsy. 6 is known biopsy proven malignancy. Biopsy confirms presence of cancer before treatment begins. So BIRADS, breast imaging reporting and data system, it is widely accepted risk assessment and quality assurance tool in mammography, ultrasound, or MRI. So mammography can show changes in the breast up to 2 years before a physician can feel them. Though it remains the cost-effective modality for breast cancer screening, the sensitivity and specificity are not ideal, but it is useful as both as diagnostic and screening procedure. Then digital mammography. Sensitivity of digital mammography is superior to screen film mammography in younger women and women with more dense breasts. Other advantages of digital mammography are telemammography, computer-aided diagnosis, and post-acquisition image enhancement. Then coming to ultrasound, useful tool to complement mammography in diagnosis and treatment. Solid masses may appear benign or malignant, and cystic masses are characterized as simple or complex. So as a guide for interventional procedures is also used. Then breast MRI. A breast MRI, also called magnetic resonance imaging, uses a powerful magnet, radio waves, and a computer to take detailed pictures of areas inside the breast. MRI is used in addition to mammograms in some women who have a high risk of breast cancer. It is indicated for staging in invasive lobular cancer, evaluation of patient with an unknown primary tumor. Then imaging in breast cancer, CT scan and PET scan are being used. So coming to CT scan, no role in routine workup, may be done in advance or node positive cases as a supplement. And PET scan, no established role in early stage disease. Its increased role in locally advanced, recurrent and metastatic cancers to identify patients with multifocal or distant sites of malignancy. So coming to tissue diagnosis, 3 types of breast biopsies: fine needle aspiration, core needle biopsy, and open or surgical biopsy. So here, sample is taken and like this, it is prepared. Now, breast biopsies and surgical procedures. A biopsy is a procedure to remove cells or tissue to be checked under a microscope by a pathologist for signs of disease. When an imaging procedure shows an abnormal breast change, a biopsy may be needed to make a definitive diagnosis. Some types of biopsies may also be used as a treatment. The needle biopsy, a procedure that removes cells, small tissue samples, or fluid so that it can be examined under a microscope. So a fine needle aspiration biopsy uses thin needle to drain fluid or remove cells. A core needle biopsy, also called a core biopsy, uses a wide needle to remove small tissue samples that are about the size of a grain of rice. And a third is a vacuum-assisted core biopsy, also called a vacuum-assisted biopsy, is used to remove a small sample of breast tissue with a probe that is connected to a vacuum device. A tiny cut is made in the breast, which is much smaller than with the surgical biopsy. Then cytopathology reporting protocol. C1 is inadequate or non-diagnostic. C2 is benign. C3 is atypical or probably benign. C4 suspicious, probably malignant, and C5 is malignant. Then challenges in breast cancer control, delay in seeking health care. What are the causes? So in India, nearly 60% of breast cancer cases are diagnosed at stage 3 or 4 of the disease. Most of the patients present to the healthcare facility only when there is a large palpable mass or secondary changes like local skin, chest wall changes are visible. Women tend to ignore the minor symptoms and do not show up at hospital until it is unbearable owing to their household responsibilities. Other factors that may contribute to late presentation include a lack of awareness about the disease, especially in rural areas. The initial manifestation of breast cancer, that is a lump, is generally not associated with pain, which further adds to the delay in seeking treatment in 50 to 70% of the cases in rural areas. Another deterring factor in seeking early care is the stigma of social embarrassment and isolation. Women not only fear death and contagion by cancer, but also fear that their and their family's reputation would suffer if people knew of their cancer diagnosis, including potential difficulties in their daughter's wedding. So, breast cancer awareness. For women to attend the hospital early, they need to be breast aware and thus they must be able to recognize the symptoms of breast cancer. Women should know how their own breasts normally look and feel so that they will notice any abnormal changes earlier. So 40 is an important number. All women 40 or older should get annual mammograms. Most lives are saved by yearly mammography starting at the age of 40. 1 in 6 breast cancers occur in women between 40 and 49. 10-year risk for breast cancer in 40-year-old is 1 in 69. A Harvard study showed that 70% of women who died from breast cancer were among 20% of women not screened. And 1 in 3 women who get breast cancer are over 70, so don't assume you are past it. As breast cancer is a topic that is not freely discussed in India because of cultural taboo, there is an urgent need for information and education on awareness of breast cancer and its early detection measures. The rising human cost, both social and economic, of breast cancer underscores the need for more holistic, multidimensional approaches that encompass the cancer care continuum, including prevention, early detection, treatment, palliation, and survivorship. Lifestyle modifications need to be included in mainstream treatment planning. A recent review has reported diet-related and physical activity-related interventions from the primary prevention of breast cancer are cost-effective. Exercise has been proven to be an effective, safe, and feasible tool in combating the adverse effects of treatment, prevents complications, and decreases the risk of breast cancer-specific mortality. So, high quality and periodic education programs with campaigns tailored to the specific cultural context of a community increases patient participation. This can only be achieved by creating and sustaining the level of awareness among general population. In recent times, the internet is being increasingly used as a reliable source to seek health-related information, as Tanuja Madam discussed about the digitally. Keeping these things in mind, a website, Cancer India, was developed by the National Institute of Cancer Prevention and Research, providing comprehensive information on common cancers in India, including breast cancer in layman's language, available in Hindi and English. A breast cancer screening program using local volunteers for early detection is feasible in low-income settings, thereby improving survival. Community health workers can play an important role in the early detection of breast cancer in low and middle income countries, with responsibilities including awareness raising, conducting clinical breast examinations, making referrals, and supporting subsequent patient navigation. Now, KVERT is the first initiative in India to create a trained task force to facilitate the cancer patient's journey from entry to the hospital to follow-up. It is a nascent area of specialty in cancer care that is set to target the pressing need of well-trained patient navigators in oncocare. The World Health Organization on March 9, 2021, introduced a global breast cancer initiative to reduce global breast mortality by 2.5% by 2040. The aim is to reduce 2.5 million global deaths, particularly in low-income countries where the progress to tackle the disease has been relatively slow. Now, acknowledging that breast cancer is one of the foremost cancers in India now, would be the first step towards making people cognizant of the disease. It is fast developing into a public health crisis, and society's discomfort to talk about women's bodies has made the situation even worse. Early detection programs in low and middle income countries must make provisions for every individual at risk for breast cancer. This will mean considering the needs of the hardest individual to reach first, so that no woman is left behind in the goal to end unjust and untimely death attributable to the leading cause of female mortality in low and middle income countries. So these are the websites and the research papers which I have consulted, which have compiled this lecture from all these references. You can take the screenshot and you can follow these papers and sites for more knowledge on breast cancer. So against breast cancer, we will win together. So this was a poster made in a poster making competition by CONCAN, an initiative by students of NBBS, and this poster was given prize, and it was made by Ali Nawaz Khan from SN Medical College, Karnataka. And here in this poster, he has compiled all the parts of the cancer awareness. Thank you so much.
Thank you, ma'am. Now the session is open for discussion. Participants can post their questions in chat box.
So in this lecture, I have tried to give an idea of where the lacunas are, where we are lacking. So we should start from our surroundings. We should make all the females around us aware with the breast care. So that will help a lot.
I request all the participants
Yeah, there's a query, sensitivity of MRI over mammography. It is there, and usually in Indian setup, most of the patients, when they feel some lump is there, they sometimes they themselves go directly for MRI and come with the report. So MRI also better, but mammography can give deep-seated lumps. They can be detected in mammography.
Thank you, ma'am. Any more questions? Ma'am, one more question is there.
Yeah. Missed lumps on mammography are detected by MRI, and since there is no radiation involved, it's better to use. We can go for MRI also, but see, no modality is 100% perfect. So whatever is available, we can go for that modality. MRI is for sure better
Thank you,
than the mammography.
Thank you, ma'am. Any more questions? Ma'am, no more questions. Shall we wind up?
Yeah, sure.
Thank you, ma'am.
Thank you so much for giving me this opportunity. And I thank Dr. Nisha Kumari and Dr. Tanuja Nesri Madam for giving wonderful insights and the inspirational talk. Thank you so much.
Thank you, ma'am. I thank Dr. Tanuja Nesri ma'am for giving inaugural address who joined us for our program. I thank Dr. Suhas Kumar Shetty for being associated with us and supported us throughout. Special thanks to Dr. Baljodkar for her informative session on breast cancer and screening. Our thanks to Dr. Usha Rani for delivering keynote address and launching Women Wellness Program. Also, I would like to thank Dr. Nisha ma'am for supporting us throughout the journey. Last but not the least, we thank all participants who have actively participated and made this evening a beautiful one. Women are the real architect of the society. Women really build a society. They build not only themselves, but a whole community. Yet history has failed women many a time to represent that a woman what cannot be. There cannot be just a day to celebrate a woman. Every day should be a day where we respect the dignity of women. Thank you all for joining us today. Please stay connected with us for all the latest updates. We wish you all the great evening ahead. Thank you.